Thank you for having me here, and it's my pleasure to be here and give a talk to the doctor in Hong Kong. And because the time is running so fast, I would like to cut size my talks, and then you guys can have everything's on time. My topic is about family acceptance in trans youth. I think Dr. Chang Ling Yang, sorry that if I pronounce it not correct, but I think the Dr. Chang Ling Yang, he's covered a lot of things that I would like to talk today. Then I'm gonna go to the main part of this is about family acceptance. Everyone hear me well? Not sure. Yes. Yeah, I would like to start with the case that we saw in the clinic. M is a 7-year trans boy who came with mom and asking for like counseling about how to deal with the parenting issue because mom noticed that M play and dress like a boy since a little. And one day M told mom that I think I'm a boy when he was 3. And when I talked to him and I would like to have a private session with mom and I asked him to draw the picture of himself, he draw this picture. I asked him, okay, can you draw a picture about what you want to see yourself in the next 10 years? And then he draw these pictures. And yeah, Dr. Zhang Lingen cover about this. Then I don't need to cover about this that much. That I think everyone know about SOGIs and the definition that W Path Youth for the recently guideline. We use the word TGD instead of transgender and gender diverse people, and we not call sex change or the sex change care anymore. We call gender-affirming care and gender-affirming surgery, and I think it's very nice word to confirm that the treatment is going to be confirm who you are, not just the change who you are. And I'm not sure in Hong Kong, but in Thailand, we love to use the gender unicorn to show about our SOGIs and sometimes then we can understand the people more because especially like a gender identity, it doesn't mean that we only have male or female, but sometimes we have both male and female identity in ourselves. Or sometimes it's going to would be the other for non-gender people. It's the same as gender expression and physical attraction and emotional attract. And I would like to skip this because the doctor said already. Yeah, I love this. They say that remember your biggest sex organ is not between your legs, but it's between your ears because our brain is quite a very important sex organ. And right now, it's not only LGBTQ. We have LGBTQQIAAN, LAAP. Then that's a lot of work that to show about the diversity of the gender and that we have. Yeah, it's not about the like race room that separate male and female. Right now, we could have the race room, non-gender race room, and sometimes we can have like whichever who wants the race room. This is the prevalence on 2007. They show that the trans women might be one per like 10,000 or one per 40,000, 45,000, but our trans men about 1 to 30,000. But on 2017 and published on 2021, they said that it could be have trans people about 0.5 to 1.3%. The latest number is about 5% in America study. In Thailand, I did the research and in the high school student, and it shows that the Thai youth report themselves as the gender diversity about 11%. Some report them as a lesbian, gay. Some report them as a bisexual, and queer is a on queer or non-binary at that time. It is have about 1/4 of the population. And it's not only in human. The study show that a lot of animals, like 1,000 species, have gender diversity. Then it's not only human that have the gender diversity. This picture, I saw that from the temple in Thailand, and I think, yeah, it shows that gender diversity happens in the long period of time. It might be the questions of the family, because they might need to know why our kids being trans or being gender fluid or gender diverse people. I think it may need to know that we're going to know about the etiology, because sometimes we can tell the parents about what is the answer. Right now, they have no study to show what is the cause or what is the real etiology of being gender diverse, but there's a lot of paper show that the nature or the developing brain or hormones or genetics have a play role of the etiology of gender diverse, and much more than the nurture or social learning or parental factors. There's a study that the one study that pretty interesting. They have the study in the twin, and part of them is not monozygotic twin pairs, and the half of them is the same-sex dizygotic twin pairs, and they see the concordance of gender dysphoria, like if one of the twin have gender dysphoria, what is the incidence of the other one? And for the monozygotic twin, they show that it's about 39% of the pairs have the gender dysphoria. But for the dizygotic twins, it's related about 0%, and it shows that genetics play a role on the gender diversity. And these studies published in Nature, and they found the scientists found that they have some of our brain we call base nucleus dia terminalis. It's like in the midbrain that might play a role on the gender. On the I'm not sure if you guys see the arrow or not. On the left upper is the part of the brain of heterosexual male or the straight male. On the right upper is show the part of the brain of the heterosexual female, or like a straight female, and the lower left, it shows the homosexual male or gay, and on the right hand side of the below picture is a male to female. And the study show that they have an autopsy of the brain of the trans people, and they found that some part of the brain it looked like the female, but it cannot explain for every single gender diverse people or trans people. Then it's just like suspicious that maybe some of our brain or some part of our brain play a role of the gender diversity. But for the social factors, like influence of the parental factors, like previously we believe in Thailand, in Thai culture, we believe like if the father have not much time to carrying the kids, sometime they're gonna make the kids to be trans or to be gay. But for the study, they have no study that confirm the parenting style or parental issue is the effect on gender development. Then now we believe that our gender or our our sexual orientation. Sometimes it might be developed intrauterine. It's affected by genetics and epigenetics, and sometimes it's from sex hormone, because we found that in the kids that we have a CAH disease, sometimes they have more chance to be a trans boy. Then we believe that our brain, that happen intrauterine, and they developing before giving birth, and then after birth, it just rise our awareness and make us know about ourselves more, about our gender identity and gender role. But usually it might happen intrauterine. And how we gonna help these youth or kids who have a transgender or gender diverse? First of all, I think we need to find the condition that we call gender dysphoria. It means the people that have persistent desire to be the other gender, not necessarily to be the opposite gender, but the other gender, whatever, or in insistence that he or she is the other gender. And they also have clinical significant emotional distress, like they cannot they're not happy, they distress when they body change and things. Then and this is a diagnosis criteria that I think you guys can have a chance to look on. But usually it's gonna be the feeling that you are the other sex, the other gender, and it could happen at least 6 months. And the other one is that it had associated for the clinical significant, the distress and impairment in social skill, the functioning in life. We have a study about LGBT in Thailand, and we found that 49% of LGBT people in Thailand contemplate suicide, and 17% attempt suicide, and only 40, like only 10, not above 10% that they disclose or come out about their gender issue with family. 92% is come out for the people outside their family, and nearly half of them experience the discrimination from or within their family. Then like the Dr. Zhang Ling said that the gender diverse people is not mental health, it's not a mentally issue, and being LGBT is not leading to mental health by itself, but because of they grow up in the non-safe environment, like the discrimination environment or the unaccepted environment. And the study showed that in the trans male or trans female, they have the study showed that the prevalence of suicide is happen more than the straight male and female. And for the transgender care, I think the doctor covered that already. For the adolescent, we're gonna have a hormonal blocker start when they entering the puberty, like when they're 10 or 2, and and then we're gonna decide to start the hormones about the age of 16, but some case that we follow up for a long time and we think that they're ready. Sometimes we start earlier, about 14 to 16 years. And in Thailand, they can do the gender-affirming surgery at 18 with the parental consent, and at 20 with the self-consent. And on the process, if start with the blocker is fully reversible intervention. Even the hormonal intervention is a partial reversible, but the only part of early reversible intervention is about the gender affirming surgery. Then the teenager gonna have time to adjust themselves to know themselves more. And also we're gonna do the psychoeducation. The first thing that we're gonna talk to the family and also the teenager that it's just a diversity, it's not an abnormality. Because in Thailand, we grow up with the cultural that used to believe that being LGBT or being gender diverse people is abnormal. We have a word that is like abnormal people if you are trans, if you are gay. But right now, we emphasize that this is diversity. This is not the abnormality. It's like a left hand and right hand. Previously in Thai culture, we believe that the normal people are gonna use the right hand. Some kids that grow up with the left hand side, they're gonna like was hitting by the teacher or by the parents to use and change to use the right hand. It's happening the same thing. Like right now we accept that even you left-handed or right-handed, you are very normal, but it's just a diversity of who you are. And gender is a fluidity. Sometimes we don't need to have a definition who we are because sometimes the gender is changed by time. Maybe today you are gay, but in the future you are might be bisexual, but it could be the fluidity. Then just no, sometimes we no need for a definition. We don't need to define who we are, but we just understand that we are we are who we are. And also conversion therapy may increase the negative outcome, and it illegal and it's like unethical, not illegal, sorry. It unethical to do the conversion therapy. And sometimes we help the teenagers find other strengths and reinforce the positive points instead of only because it's not only their gender, they have a lot of positive point or positive strength in themselves. Then we help them to find out and be themselves. And we also create the family acceptance. What do we do? Why we do the family and why do we do the counseling for family acceptance? Because the studies show that the family acceptance is the key success factors or is the keywords of the supporting system for the transgender people. And studies show that the youth that grow up with the acceptance family have very positive outcome. Like in this picture, they show that they satisfy with life more. They have a physical health more than the kids who grow up with unaccepted parents. They have higher self-esteem. They have adequate housing and adequate food. And also for the unaccepted family, the kids gonna have more depressive symptoms, consider suicide, and also have a high rate of suicidal attempt. We did the study in Thai, and also we found the same thing, that the transgender kids who are teens who come from low family acceptance gonna have higher depression and higher suicidal thought and higher score of life happiness, lower score of life happiness. And what is the barriers of family acceptance? I guess, and I'm not sure, I guess that Hong Kong and Thai people may share something in common in terms of the cultural issue, because we have a lot of Chinese people here in Thailand too. Then I think it's like a cultural and religious belief. Like in Thailand, we have Islam that believe that being transgender or being the gender diverse people, you're gonna go to hell when you die. And for cultural, like a Chinese cultural, they very like happy to have a male, have a son instead of having a daughter. And then if the only son gonna be a trans people, it's very difficult for the parents to accept this in the Chinese cultural. And also the lack of understanding or knowledge, because they was born and they grow up with a very fixed belief about being trans is abnormal. Then I think it's a transition that gonna help the parents to understand and have more knowledge about being gender diverse people. Is the diversity is normal, is not the part, it's not the illness, or it's not a mental health issue. And sometimes it's because of the social stigma or discrimination. It's happened in Thailand too. It seems like Thailand is very open country, and it seems like Thailand is very welcome trans or gender diverse people, but actually it's not, because we have a lot of stigma for the trans people. Like trans people in the movie, it's gonna look like the people that who very like extremely show their expression, and they're gonna be a joke, the comedies, the things that it's not equally for to male and female. Then and some job in Thailand you cannot be if you are trans people, like air hostess is not it's not all the airlines and accept trans people. That still have a discrimination that gonna make parents feel like being trans or being gender diverse is not safe for their for their kids. And also they fear of the youth safety and well-being, like it's going to get bullied at school, because they have a study shows that being trans is going to have a high rate of bullied in to get bullying at school. And also some parents have internalized homophobia or transphobia themselves. Then they cannot accept to the thing that they really feel bad with. And it could be the barrier could be the traditional gender roles and expectations, like they expect the man to be strong, but some boy, it might be have very neat and very like have a clear skin and very soft, and then it's some kind of the traditional and gender roles and expectations that make the parents cannot accept easily about their gender, the kids, the gender of their kids. And also some parents have mental health issues that cannot easily to get accept, like depression. Some parents go through a lot of like bullying themselves because of they having the kids that who being a transgender. And economic and social factor also play a role. We found out that, like in my clinic, we found out that the people who come from the middle or high income or high education is going to be more acceptance, because they can reach to the knowledge and they can access to the information and make them more acceptance easily. And what do we do for counseling or the parents for family acceptance in the clinic? Usually the first thing that we're going to do, we're going to deep listening, because they're going to have a lot of things under the word not accept, because sometimes it's the expectation, sometimes it's going to be the strong belief, sometimes it's going to be the love that they're caring for their kids, and they concern, they fear about the future. Then we're going to have a space for the parents to that they can ventilate, and they can tell us what's happened in their life, or what they have to deal with this issue. Then we're gonna listen to them, and we're gonna give some information that would be helpful, like gender diversity is not an abnormality. Like for the healthcare providers, this like a gender disorder or gender identity disorder is get out of the of the system. We don't use that word anymore. And also one thing that I found as when I work with the family, sometimes the family thought that gender is a choice of their kids. Sometimes then they question why you not choose to be like the normal people, or why you not choose to be like the other girls or boy, why you choose to be like this. But then one thing that I would like to tell the parents that our gender is not a choice. We just choose to coming out. We just choose to express who we are. But our gender is happen inside and it's not a choice. We just know that. We just aware of it, but we not choose it. And the other thing that I would like to talk to the parents is that the parent is not primary cause of being trans, because sometimes they get blamed to themselves and then they get angry and they cannot accept to their child and who they are, because sometimes they cannot coping with the disappointment, and they cannot keep they cannot coping with the guilt that they have to themselves as a parents. Then I just like give the general information that they have no study to show that the like abnormal parenting or what type of parenting gonna make the kids to be trans. Then they, at least they can unlock the guilting that they have to face with. And the other things that I try to do with my client or with the family that I work with, I would like them to change the perspective on the happiness in child life, because I'm not sure in Hong Kong, but in Thai culture, sometimes we're gonna have a standard of being success, of being happy, uh, and or being success in the life. Like you're gonna graduate the bachelor degree, you have to have a good job, you have to marry, you have to have a child, and the child that you have to have the two children instead of one. And it would be great if you have one as a son and one as a daughter. It's going to be like a complete or perfect family or perfect life. But then I just talk to the parents that it's not true. Not everyone that to get married is going to be happy. Not everyone having kids is going to be happy. Then we have our own definition of happiness. But the very important thing gonna make it kids or someone happy is that they can be themselves and they get accepted by the people that who love them. Then I think we can give the very normal happiness to our child by let them to be themselves and feel accepted by the person who they love. And yeah, sometimes I adjust the expectation, because sometimes as a parent, I am a parent too. I have like one child who's 11 now, and I know that sometimes we have to manage our expectation, because it's always there. I would like them to be happy. I would like them to be success, and I would like them to have a family. Then they can have the son and daughter to taking care of them when they grow up. And I like, oh no, maybe the kids in the new the new the recent world is maybe they not even come back to take care of us when they grow up. A lot of them grow to live abroad, and then I just like try to adjust the expectation and empower the unconditional love, because I would like the the parents see that even they be under the word unaccepted or not accepted, under of that is a fear, is a worry, it might be concern, and under of that is the love. They love their children, and I would like to empower them to see this, because this is gonna be the things that make them go through the right track that they have to be. And yeah, usually I'm gonna point out of the importance of family acceptance because it's a key success factor of the kids who are transgender. I'm not sure that you guys familiar with the Satya model or not, but this is the thing that we work with the family. The unaccepted is just a behavior, but under the iceberg, they have a feeling. They have a feeling about their feeling, and they have a perception. Sometimes they thought that being trans is abnormal. Being trans is gonna make your life worse, and if we change the under of the iceberg, we change that some of their perception. We try to make them see their expectation and how they're gonna deal with it as a parents, and we make them fight the yearning. Actually, they would like to be a good parents. They would like to be a happy parents. They would like their kids or their daughters, their son to be success, to be happy. Then we're gonna go through this Satya model to make the parents understand what's happened to them, what happened inside their mind. And it's when the parents can see this, and sometimes they change, sometimes they can get through to the resource that they have for their kids, then it's gonna change their perspective, and sometimes it change the relationship. And the other thing that I would like to emphasize, like, is about the social movement. The social gonna help. Sorry. The social gonna help the family to be calm and to feel safe that they they not live alone. They have the social support. They have the social that more acceptance and understand about the LGBT people. Then it's gonna be make them feel secure to let their child to grow up as an LGBT person. This is a picture of the Pride Parade in Thailand, in Bangkok, and the last parade we have 200,000 people come to the parade to celebrate the Pride Month, and I think it's very helpful. And also, we just passed the law, the equal marriage. Then I think this very, very helpful for the family to be calm and to be more accepted for the child who being the LGBT. Yeah, like Dr. Michelle said, that I'm one of the part of the committee to push this law, and I think it's very help youth and help trans and gender diverse people in Thailand, because it seems like the social and the politics in Thailand more accepted in the LGBT people. Come back to the case. I'm gonna speak in briefly. I work as I talk to you, like we listen to the family. We tell them about okay, being trans or anything is very normal, and it just let them to be themselves. We don't need to encourage them, but we not close the opportunity for them to see themselves. And yeah, this boy grow up and follow up with me now. He's 11. He's like very smart, and he's very strong, and he's like grow up with a very normally mentally people. And one day he came to me when he was 8, and he said that I would like to be a boy at school. And I like, okay, it could be. Can you talk to the teacher? And M went to the teacher and talked to the teacher that I would like to wear pants instead of dress to go to school, and the teachers very support him, and the teacher do the class we call like becoming a butterfly. The teacher like ask the student in the class to coloring the butterfly and say that you could see that even we might be look the same, but we grow up differently. And today we have one of our friend would like to become a butterfly in the way of them that they would like to be. And M stand up in the classroom and say that he would like to live as a trans boy in school, and and friend is very accepting what's gonna be in the with his friend. And after that, the school have no restroom because for the trans boy, because when he went to the boy restroom, some of the friends feel like, oh, I remember that you are girl, but when he went to the girl restroom, the girl gonna feel uncomfortable because he looked really like a boy. The school set up the non-gender restroom for him and for the other kids in the school. One day he came to me and asked, like, I would like to apply for the head of the student, but they have the category of boy or girl. And I said that, oh, you just apply as a trans people, and then he was selected as the head of the student as a trans boy. Yeah, and he just grow up to be very happy people because of his family accepted him and support him to be who he is. And he on the hormonal blocker, and he planned to do the gender affirming hormonal therapy in the next couple years. Okay, I think I would like to finish my talk. Right now, I'm not sure if anybody have questions or things that we can share. It's really welcome.